Hello, and welcome to Career Landscapes, a peek into professional lives, brought to you by One Voice for Change. I'm your host, Felicity Minch, and today we have the honor of speaking with emergency room nurse Aaron Hunt. And I would like to take a moment right now and read a bit about him. Aaron Hunt is a 2-year registered nurse who works in the emergency department in the California Bay Area. Aaron applied to nursing school in high school while working as a lifeguard, which piqued his interest in medicine. After graduating high school in 2018, he began nursing school at Maryville University in St. Louis, Missouri. After 4 years of nursing classes and clinical instruction, Aaron earned a bachelor's degree in nursing science in 2022. After passing the National Certification Exam for Registered Nurses, he began his first job at Christian Hospital Northeast in Missouri. Now working in California, Aaron's interests are in emergency medicine and the latest advances in critical care research. Welcome, Aaron. Thank you for being with us today.
Thank you for having me. It's so good to be here, and I'm really excited to talk about my experience as an emergency room nurse.
Oh, thank you so much. The students are going to love this. I have some questions, and actually, I'd like to just open up by having you talk about what is a typical day as an emergency room nurse. Not that there's a typical day, but what are your days like?
You hit the nail right on the head. I do not have a typical day. I say if I had to lay it out for you, I would wake up, whether it be I'm working night shift or day shift. I'll wake up about an hour and a half or 2 hours before my shift and, make a cup of coffee, get ready for work, go to work. Typically, they start at 7 a.m. Or 7 p.m. So you work a 12-hour shift. And I'll start off my day like going, checking on my patients, whether it be if I have one patient or sometimes up to four patients at a time. And I'll just make sure that everybody's doing okay, that they don't need anything right now. And then I really like in the beginning of my shift, try to prepare for my shift. So I'll get everything stocked, grab all the supplies that I need. Um, and then, yeah, it's after I get all set up, it's determining, what's needed in each patient at that time and talking to the team as a whole, whether it be a doctor or needing to get physical therapy or getting medications for a patient. And I'll do just a lot of talking to people and a lot of charting. I have to chart everything that I do. If I give a medication, I have to make sure that I put it in the electronic medical record. And then do that for 12 hours. And by the time that my shift's coming to a close, I hand off to the next nurse who takes over. And then that's my day. I usually go home and go to sleep after that.
Yeah, that's amazing. Do you get to choose whether you get a day shift or a night shift, or is that assigned by somebody else?
So when I accepted a job, I'll talk more about what I did in St. Louis and what I'm doing currently. So when I was in St. Louis, I was hired on as a day shift nurse. So I was only expected to work day shifts. That doesn't mean that I can't work night shifts because there's definitely plenty of extra shifts to pick up and lots of help needed. So occasionally I would work night shifts when they were short staffed just to help out a little bit. But most of the time I worked day shift in St. Louis. I moved to California and started working as a travel nurse, which you take a contract, about 16 weeks usually, and you go to one facility and they assign your shifts most of the time. So you can put in preferences, like say I was going to take a cruise and I needed 4 days off. So I let them know that I was going to take that time off. And most of the time, they're really good about working with you as long as you tell them early. But other than that, I'm kind of there to help fill the need that they have. So I just work whenever they would like assign me. And I would be expected to work full time for nurses. It's 36 hours a week or 3 12-hour shifts. So I would just come into work whenever they told me to work.
Oh, so it's 3 days on and 4 days off.
Uh, Correct. You can structure it like that. You can also structure it as um, 6 days on, 8 days off. You can also structure it as if you want to just work two, have one off, and then you'll have a longer time off. Or, there's lots of preferences when you're working as a staff nurse, you really get to choose what preference you have, like schedule wise.
Oh, wonderful, wonderful. And, in high school, and I think even college, they never talk about the strengths or the personality types or what is needed, for different careers. And I say that because a lot of my guitarist girls want to be just like Taylor Swift. But yeah, what strengths are needed to be a nurse, or what qualities are really needed to be a nurse?
Sure, yeah. I think that the running joke is that if you have ADHD, you'll do really well in the emergency room because it's very fast paced. You have to be able to change what you're doing at any given time. The first year, when I was working in the emergency room, I would think back and I'm like, did I forget to do something when I started this new task? Because you're constantly changing. Everybody, like, there's four people and they all need something, and you have to like determine what is the most important and where you need to be. So I'd say anybody that really enjoys a fast-paced environment, one where you're working with incredibly intelligent people, and somebody that has like a draw to learning, and not only learning from your peers, but also doing your own research and what interests you. I never know everything, and so it's really good to have people that go beyond just the 4 years of nursing school, or what, like, if you get a medical degree and you're working as a doctor, um, the people that go above and beyond, those are the people that will do really well in the emergency room, and I think medicine in general.
Yeah,
Yeah.
interesting. Great. Um, Also, in high school or college, did they ever teach you how to handle, or while you were in nursing school, were there classic classes or psychological classes on how to handle stress or how to handle um, everything, including death? You must have seen people die. And was there any training on how to mentally handle what is entailed in your job?
So I remember we had one, like, almost like a TED talk kind of thing from one of our professors, but it wasn't a very long conversation about death and the expectations around it, what your role is as a nurse, because you definitely play a role in the dying of a patient and consoling the family thereafter. Um, and I think that it was lightly touched on in nursing school, but I really learned a lot about that when I got into the field. And emergency room nursing is incredibly team oriented, team driven. I wasn't doing a whole lot by myself. There was certain aspects of my job that I'll do by myself, but most of the time I'm working with a group, and that includes fellow nurses in the emergency department. And so, especially after something, if somebody were to be in a really bad car accident and they came to the emergency room and passed away, we would often debrief after and talk to the fellow nurses, the doctors, not only about like what we could have done better, if there was anything that we could have done better, and talking about everybody's feelings, like how we processed it, if there was different approaches that we could have taken. Really, there's like an in-depth conversation every time that somebody passes away. So it really is taken seriously in the job environment, and I think that, I'm still learning, and it has a lot to uh, a lot to unpack every single time.
Mhm.
It's a different experience.
That's fascinating. I'm so glad that you debrief. So, I mean, you have to have collaboration skills and empathy. So all those skills are very important.
Mhm.
What do you have one? Do you have one or more impactful or um, incredible experiences that you really remember?
I do. There's one that I remember quite fondly. We had a patient who was in kidney failure. And so she was holding on to potassium. She had too much potassium in her blood, and that made her heart stop. So we had to do several rounds of CPR. And once we were able to get the potassium levels down and we got a heartbeat back, and actually a couple hours later, she like came to me and thanked me, and it was an incredible experience to be able to talk to somebody that I had done CPR on, because usually when you do CPR, they end up in an ICU, they're intubated, they're in critical condition. But since we were able to fix the problem that she had, she still went to the ICU, but it wasn't, um, she wasn't intubated, she just needed a little band-aid fix. And then we sent her to the people that are specialists, and they were able to uh, really get her the training. And there's a lot of education that's needed, and so um, that was all taken care of upstairs. But it was life-changing to be able to talk to somebody that I had given that critical care to. So
Oh, that's incredible. Wonderful news. Wonderful. Do you ever talk to her still? Maybe not, but are you in touch with
I
her at all?
I don't keep in touch with any of my patients, I don't think.
Oh,
But
okay.
there are laws around like patient
Oh,
and provider interactions, and so I don't know that it would be against the law for her to reach out, but I think it's at least discouraged for me to reach
okay.
out to anybody.
Okay. That makes sense. That makes sense. And what do you think the future of jobs will be? I mean, is there a demand for nurses right now? And do you think there will always be a demand for nurses? What do you think the future holds for the job?
Absolutely. I There is a huge shortage of nurses right now, and we are just like peeking around the corner of being short staffed, because a lot of nurses, especially in the emergency room, aren't 24. A lot of them are close to retirement or reaching retirement. And so we're seeing a lot of people leave the emergency room, especially after COVID. And whether that be to go to a different field, or just they decided that's it and I'm retiring. So there's a huge shortage, and a lot of people, or a lot of positions opening up every year, so
Good to know. Good to
yeah.
know. And my own personal last question: what do you think? How do you think AI, artificial intelligence, will play a role in the future, or is that ever discussed among the staff, or are you using AI now?
We do not use AI to my knowledge. I do think that it's never going to take over healthcare. It might help make healthcare, um, it might be able to like bring in other ideas and present options that maybe wouldn't have been thought of in the moment. But I think beyond making recommendations, there's a very large human element to how you need to approach patients, and the nuance. I don't know that an AI would be able to pick up and like maybe replace nursing.
Right.
There's a lot of healing to be said, like to be given in the human aspect. So I don't think that AI is going to take over my job, but I do think that in the coming future, it'll be a big part of healthcare, like in maybe making decisions and helping reach the best decision for that individual. I'm not an expert on the topic, so those are all just my speculations. But yeah.
Oh, Good news. So I ask students to give me questions, and I don't have them on YouTube with us because they're under 18, or most of them are. But I've got some questions to ask. So the first one is from a 16-year-old. And he said, how does working in an emergency room compare to other nursing specialties in terms of stress levels?
Well, that is an excellent question. I think that it depends on how you perceive stress. And so, if you are an adrenaline junkie and you really like being in that critical space and you want to work on your feet and um, you're asked really tough questions all the time, then I think you'll thrive in the ER. And maybe you wouldn't find it as stressful as working in med surg, where it's more like patient focused and you're waiting for the patient to heal. You're giving lots of education that's more focused on the long term recovery. So it depends on like what you enjoy. There's a huge wide range of nursing. There's obstetrics, where you're helping mothers deliver babies or giving education to mothers before they give birth. There's psychiatry or mental health. They focus a lot on maybe people that have disorders like schizophrenia or depression, anxiety. You're working with a lot of patients to get the right medication that they need or the right therapy or a broad range of treatments to get them into a space where they can function and become independent. And I think that if you enjoy that, that's an excellent section. But I think that I would find that very stressful because I would be afraid that I wouldn't say the right thing or that I might, misspeak. However, I also deal with psychiatry in the emergency room when somebody's having a severe depressive episode. They might be suicidal. And so that would be something that they could come to the emergency department and we'll sit with them, make sure that they're safe and get them the help that they need, moving them to that mental health unit. Let's see. Some people really like dealing with only that. I deal with a broad range. Some people like dealing with only the critical stuff, and that's you'll work in the ICU. I like to think of it as hyper organized chaos, whereas the ER is just like organized chaos.
Yeah.
Let's
Oh.
see. You could even work as in a doctor's office, and some people think that that's like super boring, but actually you're like almost the front lines. You're giving people information that they need to live their everyday life, and you're helping people with everyday problems. So that's a really cool little niche of nursing that I don't think a lot of people consider. But working in a doctor's office, you can have a huge impact as well. So there's also, maybe you don't enjoy working with people. Maybe you want to be a nurse, but not be at the bedside. You could do nursing research. They deal with people too, but it's less on the patient front and more on the like research front, like finding new treatments, assisting with clinical trials, or there's remote nursing jobs like you can do online. When we get a new piece of equipment, we will have a nurse usually come, and they're a representative from that facility. They'll come and they'll teach us how to use that specific piece of equipment, and then you're not interacting with patients at all. So it's really what do you find fulfilling? And I don't find the emergency room to be too stressful because I rely a lot on my team. But I could totally imagine that if that wasn't your strong suit, that maybe you would find a different part of nursing to be less stressful, but maybe one that I would find more stressful, So.
Right. Thank you for all that information. Wow, that's a lot of information. That's huge. An 18-year-old asks, How do ER teams collaborate effectively in a crisis or an emergency? I mean, how does teamwork and collaboration work in the especially in the ER room?
So I'll give you a brief walkthrough of how we would handle what we call a code blue, or if somebody stops breathing or their heart
Mhm.
stops, right?
Right.
So immediately there's a huge amount of people in that room. And like I said, we have to organize the chaos because there's a lot of chaos happening. You know, a lot of things need to happen right
Right.
now. And the way that we do that, or the way that I've handled that in the past, as the maybe leader of that, would be there's somebody sitting at a computer, and that is their whole job. They sit at the computer, they document everything, and they make sure that we are on time for all of our medications, right? That's their whole job. They sit at the computer and they make sure that we're on time and that everything's documented correctly. We also had dots on the ground for specific roles. So the doctor will be at the head of the patient, and that's for several reasons. Maybe we need to intubate the patient or put a tube down someone's throat so that they can breathe. That would only be in severe critical, like
Right.
a critical scenario. And then, so the doctor's at the head of the bed. They're watching everything. They get the whole view of the room, and they're like the brains of the operation, right? We'll have somebody ready to do CPR, and they will stand at the bedside, and that's their entire job, is to stand there. And if they need to do CPR, perform CPR. We'll have a line of people ready to switch out because it's really intense. Doing 2 minutes of CPR is hard work.
Oh yeah.
Um, and we switch out every 2 minutes. Studies show that after 2 minutes, your CPR becomes less effective. So you switch out for a new, fresh person. And it's important that you have people to um, help, give that person a rest. We have sometimes a pharmacist that their entire job, they got their doctorate in pharmacy, and they come down to the ER and they're in charge of medications. That's their specialty. They know what medications do what. And well, I definitely have a background. I took pharmacology, and the doctor has a definite background. It's their whole job to prescribe medications and find treatments. But there's somebody that's like, that's their hyper specialty. And so it really is a collaboration between me, the doctor, the pharmacist, and everybody else in the room. So he'll be in charge of drawing up the medications, maybe making recommendations for medications. It's not his job to prescribe the medications, though. That's the doctor's job. And we also have several other team members. Usually, I believe most of the United States calls them patient care techs. However, they don't have a formal degree, a formal college degree. They go through a special training. I believe it's 6 weeks, and that 6 weeks allows them to receive enough training to enter the emergency department or whatever field they're looking into. And they tend to do things like if we need something, like in the code scenario, a patient care tech would be in charge of maybe giving CPR or running to get things. Like if our room is missing something and we need it, let's just say we put pads on people. If we didn't have the pads, they would run and get it and bring it back, and maybe apply the pads, or maybe they could help put on stickers for an EKG, or gives us a look into the heart, the electrical activity of the heart. So we'll have like that runner guy who's kind of everywhere, just kind of, he's also like, or she is just kind of looking at the area, and it's like, what can I do? Is there anything that anybody needs? So it definitely, like, the way that we create organization is we define roles as soon as we can. So who is the doctor? Who is the person charting? Who is working the medications? Who's, giving CPR? And
Right.
that's how we handle that in an emergency.
Right.
But I think that what might not be covered in that is that we do collaboration in non-emergency departments. That's kind of our whole job, is to you come in and you say, hey, I have this issue, and then we get you in contact with the doctor that specializes in that. We have a broad knowledge base, but somebody that has a specialized or that specializes in that, maybe you need to go see a gastroenterologist. You're having acid reflux. So we would send you to that doctor, and they would be like, hey, I see this all the time. I know exactly what you need. And they would do their evaluation. But it's our whole job to like get you in contact with somebody who is a specialist in that field. So collaboration is definitely something that we deal with a lot.
Yeah, that's a critical skill. Critical
Absolutely,
skill.
yes.
Oh, I've got let's see. Oh, a 14-year-old asks, what advice would you give students who are interested in ER nursing or even going into nursing?
Um, I would say that you um, definitely should get started as a patient care tech or volunteering in the hospital. Then you don't even have to um, get a degree or any sort of training. And you can really like go into the hospital, see if that's even something that you like. Maybe you'll get in there and you'll be like, this is not what I was expecting. And that's good. Then you don't have any student loan debt, or you haven't, wasted too much time. Not that it's wasted. You definitely always get to keep your knowledge base, and that can go along with you to your next career or whatever you decide. But then, you can start somewhere that would meet your expectations. So I'd say, like, if you're interested in nursing, definitely go to a hospital, see how you can volunteer, um, and get in that space, see if you like it. Going to nursing school is definitely a very hard 4-year degree. Or it doesn't have to be a 4-year degree. You can get your associates in nursing, which is only 2 years. Um, but take the time to like see if you enjoy it, because I didn't have that advice. I was a lifeguard in high school, and I just kind of dove into, I was like, what degree do I want to do? And I was like, maybe nursing would be fun. So I went to nursing school, and thankfully I really enjoyed it. But it kind of was just like oh, well, I guess I'll see how this works, and I jumped into a 4-year degree. Um, so maybe don't do that. Maybe go and see if you like it. And buckle up, because that's a long 4 years
Yeah.
where you learn so many things. Pharmacology, or the study of medications. Pathophysiology is the study of the disease process and how that affects the human body. I studied uh, chemistry and um, adult health nursing, pediatric nursing. You cover every specialty in nursing school, and you'll do clinicals, which is something that you do in the second half of your nursing degree. They send you out to different hospitals in the area, and you'll work on different floors. You'll get to experience everything from emergency room nursing to ICU to med surge, every field in your nursing specialty. And I would also encourage that you go into your clinicals with an open mind. Maybe it's not something that you enjoy, or you think you wouldn't enjoy, but you'll get in and you'll be like, wow, this is really not what I thought it was. And maybe, having an open mind and going in and experiencing things like would encourage you to try something else. Maybe you thought you were going to be an emergency room nurse, but then you really actually enjoyed working in psychiatry, So
Fascinating. That's so great. A 20-year-old asks, she's in college, how has the opioid crisis and drugs impacted your work? Are more people admitted because of the drug crisis?
I think it depends on where you work. Inner city hospitals tend to see a lot of drug overdoses. Um, I, wow, that's a really hard question. I do see lots, or not lots, but I do see patients who have overdosed. We have a special medication called Narcan that we use if there's a suspected overdose. The current um, research shows that you need to, that you can give it even if you only suspect an overdose. And if it's not an overdose, if somebody had just fainted, it's not going to do any damage. So it's better to administer Narcan and then get them to somewhere that they can be stable. And we might, depending on how severe the overdose is, we might end up admitting them. Sometimes they will end up leaving the hospital AMA or against medical advice. And as long as they are sound mind, they can answer questions like, are you here? Or not, are you here? Where are you? How old are you? What month is it? What day is it? Assessing if they actually have their faculties.
Right.
Then they're allowed to, a human is allowed to make decisions on their own. It's called autonomy. And as long as they understand the consequences, they're absolutely allowed to leave. But we do really push in the emergency room for getting the help that they need. There are lots of, usually they're government funded programs where they'll go to a rehab facility and receive specialized treatment from a doctor that deals with that condition, and they, I don't think that addiction is really understood as well as I would like it to be, but there's definitely lots of resources out there, and it's my job in the emergency room to help people get the resources that they need in that situation. So that's definitely part of my teaching when somebody's like leaving AMA or going to the ICU or wherever their next step is. It's definitely important that the nurse takes a second and is this is a treatment option that is available to you, because a lot of people don't know that it's available to them. So
Right.
yeah.
Right. Oh, and the next one, what does triage mean?
Wow, that is so that's a great question. We have two types of triage. So we have the typical triage that you all would see. So you come into the emergency room and you'll go and you'll see a triage nurse, and they grade almost the patient based on their, it's called an emergency severity index, so ESI, and it's a 1 through 5. Grading isn't the correct word, but like they assign the 1 through 5 to that patient, and that's kept track in our electronic medical record.
Right. Is one critical, or is one not? One is critical, really bad, and 5 is not so bad.
Yeah, so 1 is loss of life or limb, or they need an immediate intervention, whether that be CPR or they need to get intubated, or we have this special machine called a BiPAP. It's a mask that goes on your face and it like pushes air into your lungs. And that helps people who are really short of breath, if they're asthmatic, or some people have COPD, or chronic obstructive pulmonary disease. Their lungs don't work as effectively. There's lots of conditions that we would use a CPAP on. And so that's level 1. Level 2 is just below that. Those are the people that could become critical, and they need to be seen right away by a doctor. 3 is what I see most of, and they might require several resources, but their risk of becoming severe or very critical is not very high. I wouldn't say low, because if it's ignored, then obviously they'll advance and become more critical. But that's like typical of what I see. And then stage 4, or ESI level 4, is when you're coming in for a routine test, or something that we would only need a few resources for. So like during COVID, it was really common for people to come in for a COVID test. So if you came in and all you needed was a COVID test, that would be an ESI level 4. And then we have level 5, which is something non-urgent. Usually it's like these patient or so let's say you have a seizure disorder, epilepsy, and you went on vacation, but you left your medications at home. So you could go to the emergency department. We would contact your doctor and make sure that you have that prescription. And then we would let them know that we ordered a new prescription and we would give them the prescription that day so that they could, you know, and that's one way of handling it. The other way of handling it is you could reach out to your primary care doctor, and oftentimes they can send a medication to a pharmacy near you, but that's one way of handling it. And then the other thing we have is called reverse triage. We only do this in natural disasters. And it's kind of, we look at who can we get out of here first. So we have different colors for this one. I wish I could remember all of the colors, but the goal of a reverse triage is to get the least critical patients out so that we can handle the more critical patients. And that only happens in natural disasters or I guess like if there was a bombing somewhere, you know, like any sort of disaster like that, that would be a scenario where we might do reverse triage. So
Right. Yeah. Wow. I hadn't even thought about that. Yes, and a fifth grader asks, can you tell a doctor what to do, or do doctors listen to nurses?
So I think this question stems from there's a hierarchy in not in nursing, but in the medical field. And really the way that our hospitals run, at least from my experience, is that we are a team. You know, the doctor comes in and they make the decision of what needs to happen, and they go and talk to people, whether it be their primary care doctor or somebody who specializes in that patient's specific condition, right? And so, yeah, I talk to doctors very frequently and I say, hey, I think this patient is maybe they're going downhill and the doctor needs to go back in, but I am seeing the patient for several hours. The doctor comes in and gets maybe 30-minute snippet, and so they have to make decisions based on my assessment and also their own assessment. And so yeah, doctors definitely listen to nurses, and I would say it's actually encouraged for you to tell a doctor, hey, I think this is happening. So yes, definitely keep the doctors up to date. Part of my job is administering pain medications, and so we I'm the person who goes back in and assesses whether or not the patient has recovered from pain, and then the doctor can make the decision of what they need to do next. And I would let the doctor know that the pain has resolved or that they need more pain medication. So yes, it's definitely a collaborative team effort.
Great. She'll be happy to know that. And then an 18-year-old asks, what kind of career advancement exists in nursing? And I think he was trying to ask, are nurses' salaries dependent on their level of nursing? He was asking about salaries.
So it really depends on what your goal is as a nurse. I really enjoy bedside nursing, and that's working with patients, and that does get there's a level of I get to choose my own salary. So like when I am applying for a job, I would say, oh, I hope, or I want this salary. And the hospital kind of like decides, is that the going rate for your level of experience? There are other things that you can do. Like I'm currently working towards getting my certified emergency nurse, and that's like going through and getting board certified as an emergency nurse. That obviously increases your pay, but also gives you, I am learning incredible things that apply to nursing. And there's specialties in every aspect of nursing. There's always a board certification for, like, there's certified flight registered nurse. Those are the nurses who go on planes and go back and forth. It's not required for your specialty, but it makes you more marketable and it makes you worth more.
Hmm.
So that's one way that you can advance. The other way that you can advance is through years served. They do pay more if you have 5 years of experience versus if you're a new grad. The other way that you can do is you can go back to school. Maybe you want to be an NP or a nurse practitioner. They work alongside doctors to make decisions for usually less critical patients.
Hmm.
And if that's what you enjoy, they can make a decent salary. You could go to be a nurse anesthetist. I know that a lot of people look into that and they're like, whoa, they make a lot of money, but you have to go and you have to pass boards and it's more schooling. I think it's 3 years. I could be wrong, but it's more schooling and you have to get your specialty. The other way that you can advance is you can be a nurse educator, or you can do manager positions. They work less alongside the bedside nursing and they're more running the department. Educators kind of keep me up to date on current research. It's their job to make sure that I'm compliant with my licensure. Let's see, they assign me modules that will teach me things for the emergency department specifically, so that
Hmm.
I'm always using the right research, right?
Hmm.
And a manager just kind of like runs the whole department. So if that's what you're interested in,
Yeah.
um, you can definitely move up, and yeah, there's lots of ways to expand as a
Oh,
nurse.
good. There's a lot of moving parts.
Absolutely, absolutely.
And a 14-year-old asks, we've covered this a little bit. How do you deal with stress? Have you ever had someone you know show up in the emergency room? And if that happens, would it affect your ability to work on them?
Yes. Wow. Those are really good questions. So let's start with stress. I deal with stress by, I always structured my schedule so that I would work 3 days on and I would have a chunk of time, 4 days usually off.
Mhm.
And that helps me like really get back to my, being me. I'm able to like do my home routine. Maybe I'll go work out. That helps with my anxiety around my job, or doing things that you enjoy. I really love growing plants. You can't see them, but I have tons of plants in my house.
That's good.
Um, and that brings a level of calm that I just really love. So finding a hobby that you really enjoy, because you'll have a lot of time off. 4 days a week is more than most people
Mhm.
get. And I love diving into my hobbies or continuing research. That's something that I do to help with or help with my stress level, because I feel like if I know the outcome, I know like how to treat this, I know what to expect when I walk into a patient's room, then I feel less stressed because
Yeah.
I know what to expect. Uh, and so I think that's how I deal with
Yeah.
stress.
Yeah.
Healthy diet, all of the things that
Mhm. Yeah.
doctors tell you.
Uh-huh.
That helps with stress. Someone shows up to the emergency room. I have had, I've only had it happen once. Somebody that I went to college with showed up in the emergency room, and I just let my charge nurse, or the person who's like you go to with issues, they kind of are working alongside the manager to like make sure that the day-to-day things happen.
Mhm.
Um, I just go to them and I say, hey, I can't work with this person. I have a previous relationship. Um,
Cool. Okay.
and they just are assigned to a different nurse. That doesn't mean that I can't go say hi. Totally can. And I would just be going in as a friend. I wouldn't be going in as somebody who is like working there.
Yeah. Is that a law that you can't work on someone you know, or is that a personal thing that you personally would not want to work on someone you knew?
So I don't believe there's any law that prevents me from working
Right.
on somebody that I know, but it's kind of unethical because am I making the best decision for them? Am I unbiased? I have a past relationship. So maybe like it's
Understand.
just not necessarily ethical for me to work on them, and it's quite easily remedied. I'm
Mhm.
working with a whole team of nurses, so I just
Right,
it would be assigned to somebody else, and
right,
usually there's not an issue. We would just
right,
swap,
right,
and yeah.
right. Wow,
Um, was there a
great.
third part? Did it affect your ability?
No,
No.
I think you covered that. Wow, that's wonderful to know all that. A 17-year-old asks, what are the biggest challenges of being a nurse? And what's the downside of being a nurse?
I think something that's not covered very much is violence in the healthcare setting. The
Really?
it's it's almost like kind of swept under the rug, but when you watch TV, there used to be a lot of like, oh, the doctor would come in and they would give a heartbreaking diagnosis, which is very hard to hear, you know, for anybody. And some people, the way that they cope with that is they lash out, and that's um, not a way that should be handled. And I think part of it is part of the way that we can handle it is, coming to the root of whatever is going on with that patient. And it definitely is a multifaceted, we need to include a lot of people in their team, help in any way. It's very patient specific.
Mhm.
Um, and so I think that that's one of the biggest downsides is violence in healthcare. And I think that it's much more common in the emergency room. Um,
Do patients just lash out physically? I mean, do they hit or are they like emotionally abusive or
I would say that I don't very often see physical violence. Occasionally it happens,
Mhm.
but most of the time, people are just very upset and they yell. And so giving them, maybe they need space, so giving them the space that they need to calm down and then going back later, like using nursing judgment to determine um, what that patient needs, and also like being upfront and saying that violence isn't, it's always against hospital policy for violence. And so getting the right team, if you need to get security involved, or there's lots of ways, but you obviously don't want to escalate the situation either.
Right.
They're going through something, and so that's why it has to be like very patient oriented how you deal with violence in healthcare.
And they might be affected by drugs or alcohol or
Absolutely. Yeah.
something.
Or, some people just have like a bunch of stuff going on in their home life, or,
Mhm.
there's so many reasons. And that's why it has to be, very a personal approach,
Right.
finding out what that patient needs. Yeah.
Good. 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 Well, this has been absolutely fascinating. I've got these are all the questions that the students asked, but I would love to ask three. I end every interview with three questions. And my first one is, what advice would you give young people today?
Um, so it's a big question. Specific advice that I would probably give, like prospective nursing or healthcare students, is that you don't have to do a traditional pathway. There are lots of, let's say you really struggle in school, becoming a student nurse tech or a patient care tech and working alongside nurses and doctors, you're really going to learn a lot just being in that environment. And it can like almost structure, and it takes longer, but then you're not doing it so intensely, right? I did 4 years and I got my bachelor's right away. But another way to do that is you could become a student nurse tech, and you could um, get get started in the ER or wherever your interest is, and then go back to school to get your associates. And then you're still working that whole time. You're getting hands-on experience. You're getting a paycheck, which is good. And then let's say you want to go further. You could do whether online classes or in-person classes to get your bachelor's, and then you can get your master's, whatever you um, however you want to approach it, wherever you want to stop, if you want to stop. The other thing that you can do is maybe you get your CNA and then you decide, oh, well, I want to be a PA, a physician's assistant, or I want to be an NP, or, determining where you actually want to end up. Maybe you want to be a doctor. Getting that background and then going to school to do whatever. I think that that's a huge thing. And it doesn't only apply to healthcare either. Maybe you want to work in tech. And so going and volunteering somewhere, or getting a job doing something, just getting in the field and seeing
Mhm.
if you actually like it before you commit to a 4-year degree
Yeah.
or however long degree it is.
Right. Right.
Um,
Huh.
yeah. And I wouldn't go in with rose tinted goggles. Everything is, you're going to be doing it for the next however many years. So
Yeah.
get that reality.
Yeah. Yes. Yeah. Great. Great advice. And the second question is, what gives you hope in this world? What gives you hope?
Um, Watching people do something that they're passionate about, that gives me a lot of hope. The specific thing that I would go to is I work a lot with doctors who have spent countless hours studying specific things, and
Mhm.
just hearing them talk about something that they're so knowledgeable about really gives me hope for not only the patient but the outcome and life in general. It's just
Yeah.
refreshing to work with people who really take an interest in something that they do on a regular basis.
Mhm.
I love that some YouTubers that I watch that give me hope is like John and Hank Green. Hank, I believe it's Hank specifically, is working on tuberculosis research, which is something that I have a really
Mhm.
uh, lot of emotions towards, because tuberculosis isn't something that you see in the United States, and we've, for all intents and purposes, cured it. And so it's the fact that it's still out there killing people is just wild to me. And I think that it gives me a lot of hope to see that people who have a lot of power, like whether it be through, Hank has YouTube,
Mhm.
a YouTube base, and he's using that to really push for global change and getting people the help that they need. And I think that that's incredible. And, it definitely gives me hope for the future.
Oh,
Yeah.
great. That's inspirational. And my last question is, who inspires you?
I am going to talk a little bit about who inspires me in healthcare. When I was working in St. Louis, I got to know a lot of the doctors personally.
Mhm.
So Dr. Koyejo, he is an excellent doctor that I really enjoyed working with, and he um, just knew exactly what the patient needed, and it was good to work with him. But he wasn't the only one. Dr. Kanala, also fascinating man, and he has just countless years working with patients, and seeing him communicate with patients. It's almost like he knows exactly what's happening before. Dr. Morris was a fantastic doctor that always got along with patients, and he just like would walk in and instantly the patient would be like better already. And I'm like, I don't know how you walk into a patient's room and make them feel better, but you know, so working with uh, just several of those doctors, all of them were great, and they were all inspirational to me. Um, let's see. Um, John and Hank, from
Yeah.
YouTube, obviously, uh, they inspire me to do more with my life. I'd love to get involved in TB research and fighting it globally. So that's something that once I have more education and maybe more the means, I would love to volunteer for. Yeah.
That's so cool. Oh, well, it's been so pleasurable talking to you. You are so knowledgeable, so young, and you are such an inspiration. Thank you. Thank you. And we all need people to be an inspiration, and you are an inspiration.
Oh, well, thank
So
you so much.
there will be so many students that watch this video and learn so much and will be inspired by you. So thank you for your time. Thank you so much.
Of
Thank you.
course. And if any of them, any of your students or anybody, I'll pay attention to the YouTube comments once it's posted. But if anybody has questions, feel free to reach out to me too, and
Oh,
I'd love to
thank
answer them
you.
too. So,
I was going to ask you if somebody could email you or email me and I could send it to you if they have any questions. So thank you so much. You're so kind. Thank you.
absolutely. Thank you for having me.
Thank you. And everybody out there, thank you for watching this video with Erin Hunt and on emergency room nursing. And thank you for watching One Voice for Change. All the information about One Voice for Change and any information about Erin will be in the links below. So please like, subscribe, and share this video. And thank you. Until next time. Bye-bye.